Live in Western Oregon, this is NBC 16 News at 5:30.
Good evening and thank you for joining us. I'm Jacqueline Mazer. As the coronavirus pandemic continues in Oregon, some local nurses say they're not only working to help patients, but are also worried about where they work. NBC 16's Perry Elia-Durrani is live in the newsroom tonight. Now, Perry, some nurses are worried they will not have their employer's support if they contract the virus.
That's right, Jacqueline. A local nurse who works at Kmtr Medical Center spoke to us about the situation. They're joining the Oregon Nurses Association in its criticism that nurses are being left in the dark about the conditions of their patients and what happens if they contract COVID-19 on the job.
Nurses working on the front lines of the coronavirus pandemic have received no shortage of public appreciation. This parade, put on by Springfield's police department to thank healthcare workers for their dedication during this crisis. But Oregon Nurses Association Representative Kevin Mealy says in many cases, nurses aren't feeling that kind of support from their employers.
For many workers, it's not an if question, it's when. And how bad will it be?
One nurse at P.M.with Medical Center agreed to talk to us anonymously, saying they're afraid of retaliation. When the pandemic began, they say their hospital faced a testing shortage, like other medical facilities.
Most of the time, we are unaware of what the status of a patient is, what sort of protections we need to take for patient safety, home safety, community safety.
P.M.with declined an interview, but tells us in a statement they've always followed strict guidelines and CDC recommendations for safety and is beginning to test all admitted patients. The hospital adds that its employees are covered by regular sick leave and workers' compensation benefits. But according to Mealy, that's not enough. He says nurses need a separate emergency sick leave plan. The latest update from the Oregon Health Authority says around a fifth of all people who test positive for COVID-19 are healthcare workers. Mealy claims P.M.with doesn't have a separate pool of sick leave if nurses contract COVID-19 on the job and don't have any of their usual sick time left.
Nurses need to know, particularly if they aren't being protected at the bedside, that they will be protected on the home front and they'll have leave they can rely on.
P.M.with says employees who most likely contracted COVID-19 at work would receive workers' comp if they test positive. But Mealy claims the language of that agreement is loose and may force nurses to prove they contracted COVID-19 while working in order to receive workers' comp, as other hospitals have already done.
And proving that you caught COVID-19 at work can be really tough. The testing can sometimes take days to go through, and nurses don't have access to past patient records due to privacy laws. Of course, there's also the possibility that the patient you were working with was asymptomatic and was never tested. The nurse tells me they're prepared for this reality.
I would have been told to stay home for the 2-week period of quarantine. Unless I had enough vacation hours on hand, I would not have been paid during that time.
Despite yet another uncertainty, they tell us nurses remain undeterred in their fight against the virus.
Most of us want to be at work. Most of us want to be there to help people that are sick. That's our passion.
That passion beating out fear as the community thanks nurses, bracing for another day on the job.
Now, P.M.with isn't alone. ONA says around 25% of Oregon hospitals they work with lack emergency sick leave plans or aren't finalizing plans to implement them.
Great report. Thank you, Perry. Well, if you're concerned about employment and health insurance, there's a new emergency order in place that can help. This is what the order requires health insurance companies to do. Provide at least a 60-day grace period to pay any past due premiums. They have to pay claims for any covered services during the first 30 days of the grace period. And they have to extend all deadlines for reporting claims and other communications. The order is in effect through June 3rd and can be extended in 30-day increments during the course of the coronavirus outbreak. Well, in our 5 o'clock broadcast, we talked about Whitebird opening an affordable dental clinic for the community. Our Cassandra Gutierrez is back in the studio tonight to tell us how the nonprofit is likely preparing for a huge influx of patients. Cassandra?
Jacqueline, the dental clinic serves low-income and no-income community members on a sliding scale. Now they anticipate to see more community members during these difficult financial times, and as a result are looking to hire dentists and dental assistants at their Eugene location.
Whitebird Dental Clinic is gearing up to see more patients. The number of those patients is still uncertain.
Previously, we're seeing about 200 patients each week. I don't know if Lane County, what our figures for unemployment are, but reasonably we could see another 50 patients per week.
Whitebird staff has been prepping for this day per Governor Kate Brown's orders.
The governor requested that we have enough PPE on hand, that we did some training on our N95 masks, that we did some training on putting on our personal protective equipment, and that we had a plan to close if need be.
She says they are ready to go and geared up to offer their dental services.
We're excited to be back to work. It's nice to have a little bit of normalcy in this time and to be able to do the jobs that we were trained to do. So we're excited about being able to help the community.
And if the community is looking to help the nonprofit,
you can always use donations because we do sliding scale dentistry. We can use referral of patients that we can help. We are giving each patient a cloth mask, and so if there are people who are sewing and have some cloth masks that they could donate to us, we would appreciate that.
If you are in need of dental services, Whitebird accepts anyone that is low income or no income, as well as some forms of insurance. For details on how to help or how to use their services, head to our website. That's NBC16.com. Jacqueline?
All right, thanks, Cassandra. Well, turning now to coronavirus here in Oregon, Oregon Health Authority announces 77 more coronavirus cases and 2 new deaths, making that 2,915 cases and 115 deaths. Despite adding those cases, less than 110 of those people are in intensive care or on ventilators. In our region, Benton County has 40 cases. Lynn County still has the most in our region with 99, 34 total positive tests related to their Albany facility, where they're looking to reopen possibly within the next 24 hours. Here in Lane County, we added another case, making that 56. The new case is a person in their 50s from Eugene Springfield who is medically stable at home. Deschutes County has 81 cases. Douglas County stands at 24. Cases in Coos County remain at 28. All but one case is related to the Shutter Creek Correctional Institution. Well, it's one more reason to celebrate our healthcare heroes. It's National Nurses Day. A time usually reserved to honor nurses for a day has turned into months amid the coronavirus outbreak. NBC 16's Stephanie Rothman spoke to staff about what the support means to them.
As we all know, nurses are instrumental in helping COVID patients on the front lines every day. So it was a real honor for me to speak with a couple of our local heroes about what this week of appreciation means for them.
So we really feel the love throughout the entire hospital. And COVID or not COVID, the nurses in this community are heroes.
Smiling through the hard work treating a dozen patients with the virus, nurses at Peace Health remain positive. They put up signs of encouragement on the walls and on the windows, the words hope and love shining through.
Those are kind of creative ways that we're trying to celebrate the nurses when we can't do it our normal way of coming together in a big celebration.
And then there's the community celebrating them right back.
It means a lot to have the community show the support behind us. And every day when I drive in, there's a new sign or there's community members outside holding signs.
Not to mention pounds of donated food and donations pouring in daily. Small gestures with big impact.
We all can feel isolated right now in our personal lives and our professional lives. And so really trying to be there for each other so people feel really cared about during this time.
And it shows. All of their patients have regained enough strength to leave the hospital. Hospital staff sending them off with a goodbye, fit for a champion.
I couldn't be more proud to celebrate the nurses during Nurses Week this year. It's just symbolic of something that she and I probably will never live through again.
It's not just about Nurses Day. Nurses will feel the love along with teachers this week in appreciation. So if you have some time, show them your love. Reporting from my home, I'm Stephanie Rothman.
Latest reports show all known coronavirus patients in Lane County have been well enough to leave the hospital and continue their recovery at home. Well, Well, a deadly crash in Springfield this morning is still under investigation. The crash happened on 5th Street and Centennial Boulevard. Springfield police say 2 cars were involved. They say the driver of one car was pronounced dead at the scene, while the driver and passenger from another car were evaluated for injuries. The identities of those involved have not yet been released. The cause of the crash is ongoing as the investigation continues tonight. Well, the Oregon coast is a summer tourist destination. The number of wheels on the road may be down now, but the lifting of restrictions has law enforcement worried. NBC 16's Lauren Negretti explains.
OSB Coos Bay has noticed an uptick in the number of serious injury and even fatal traffic crashes on Highway 101.
Law enforcement's area of concern is from the Lighthouse School and the end of its school speed limit to the Highway 42 junction.
Woods says this area sees what state police call the fatal 5 factors, including high speed, lane usage maneuvers, distracted driving, and impaired driving, all leading to crashes. He says there's some concern.
When people are free to, travel about again, that we'll see even bigger uptick in the number of people on the highways.
In this area in particular, they're forming a plan.
There is a partnership between the state police and ODOT to look at the corridor, to look at the crash reports, make some recommendations, and then look at some solutions that might help improve safety.
ODOT says they are awaiting the official recommendations from state police to analyze all the information.
What we're seeing out there could be related to speed or driver behaviors.
Latham says they'll encourage drivers to keep their eyes on the road and follow traffic laws. For now, Woods says the first step is extra patrol cars in the area this summer and reaching out to the community. He says they plan to recommend changes to signage and lane markings, things that may take some time.
We have a responsibility to keep people safe.
Reporting in Coos County, I'm Lauren Negretti.
Wood says they're also planning to reach out to the school district for suggestions, but that's been put on hold until they know what the school will look like in the fall. Well, the Oregon Department of Education says more than 350,000 students on free or reduced lunch will get cash to replace the lunches they normally would have had at school. Families will receive $5.70 for each child for every normal school day from March 16 through June. Families who receive SNAP benefits will get the money on their Oregon Trail cards. Those who do not have SNAP benefits will get a card sent to them in the mail. You can apply for the free or reduced lunch program online. Well, coming up on your only local news at 5:30, Mother's Day is just around the corner. How flower shops are dealing with a boost in sales.